right, welcome back to our latest BCBA exam practice question series from ABA Exam Review. And we're going to go through this next set of questions together and break each one down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Kara buys several different stimuli at Target for a preference assessment she plans on doing today. When she sees her client, she lays out all the stimuli on the table and asks the client to pick their favorite item out of the 10 items. When an item is selected, she removes that item and makes note of what was picked first. What assessment does this most resemble? All right, it's an assessment question, so let's try to identify first what type of assessment is it. Generally, well, in this case, they give you the answer, right? We know it's a preference assessment. So now we need to identify what type of preference assessment is Kara conducting. And a rule of thumb is when you're trying to determine what preference assessment you're using, first ask yourself, how many stimuli am I testing or measuring at once? And if you're measuring a single stimuli or one stimuli, it's usually going to be a single stimulus assessment. 2 at once is typically forced choice. 3 or more is typically a multiple stimulus assessment. And if you're just letting the client roam their environment, it's naturalistic. So that's a good rule of thumb. In this case, how many stimuli do we have? Well, we have 10 items. She puts all the stimuli on the table all at once and gives the choice of 10 items. So then we ask ourselves, what happens when the item is chosen? Well, when the item is selected, she takes that item away and makes note of what was picked first. Since it isn't mentioned that she puts anything back or replaces anything or replaces the other items, then we're down to 9 items. So item is picked, item is removed, down to 9 items. What assessment does this most resemble? A, multiple stimulus with replacement. Well, with replacement, she would put that item back and replace the other items. She doesn't do it. She takes that item away. So what we're looking at is B, multiple stimulus without replacement. It isn't forced choice. Forced choice is 2 items at a time. And it isn't naturalistic because it's contrived as she's at this table making her client pick a certain set of items. So what she's doing is a multiple stimulus without replacement assessment. After a year of ABA, John has made incredible progress with communication and social skills. His parents would like to write a review for the clinic that provides services and asks the supervising behavior analyst where they should post it. What is the best response from the behavior analyst? This is a testimonial question, and there are specific rules in the ethical code about testimonials. So, what are those? First, current clients are not allowed to give you testimonials. You cannot take their testimonials. You cannot use their testimonials in advertising. If you're advertising non-behavioral services, that's a different story. In this case, though, John is a client. He's made progress, and the parents want to write a review for the clinic that provides services, which would be for advertising purposes. Current clients, we cannot do that. Now, if this client were to go and post that review without asking permission, and we have no control over the review, that's a different story. But since the client asked the behavior analyst where they should post the review, the behavior analyst now can control whether or not the testimonial or review gets posted, and they have to put a stop to it. Past clients, or people who are no longer your clients, you can get testimonials from them with some caveats. In this case, what is the best response from the behavior analyst? A, accept the testimonial and ask that they submit it personally to the analyst who can then share it. Absolutely not. We cannot take testimonials from current clients. B, thank them from the offer but refuse to accept the testimonial. B is the most ethical way to go about this. C, ask them to post it on Yelp or Facebook where the testimonial is out of the analyst's control. Well, that's not necessarily true because the analyst knows about it. If the client were to do that without telling the analyst has no control. However, if the analyst saw it, they would still need to ask them to take it down. That is not a loophole. And then D, accept the testimonial, post a disclaimer whenever it is used. That would be for not current clients. Since this is a current client, they need to thank them for the offer but refuse to accept the testimonial. Stuart wants to conduct a research on a group of children that he works with at his ABA clinic. The intervention will involve group contingencies and differential reinforcement. The children are all between 10 and 13 years old. prior to starting, what does student need from the children? Now, the key to this question, which appears to be a consent, assent, informed consent question, would be the age. And the ages here are 10 to 13 years old. Now, why does that matter? Well, that matters because children under 18 or people who are unable to give consent can give assent, meaning they can agree in some capacity to participate. And if Stuart wants to conduct research on these children, he needs a certain type of assent or consent. So what does Stuart need? A, consent, B, informed consent. Consent and informed consent are for over 18 individuals, clients and stakeholders and the like. There's a difference between consent and informed consent, which we cover in some of our other videos. But in this case, since they're under 18, Stuart is going to need assent. So it's a little technicality, but it's an important technicality to understand the difference between consent and assent in research and when you need both. You always need assent from your clients, or in this case, the subjects, before starting the research. So Stuart needs C, assent from these 10 to 13-year-olds. A behavior technician is told to present the client with a worksheet. If the client engages in the target behavior, the technician is told to remove the demand for 15 seconds and then reintroduce the demand. What is likely occurring in this scenario? So this is interesting, right? Because we're looking at this scenario and the client or the technician is presenting the client with a worksheet. And if the client engages in the target behavior, the technician removes the demand. Now, typically, we wouldn't do that, right? Because we're reinforcing the escape behavior, and it's not necessarily what we want to do. However, when would we do that? In what situation or scenario would we want to actually attempt to reinforce or see how the behavior responds to possible reinforcement? A, ABC narrative recording. Well, with ABC narrative recording, all we're doing is taking note of antecedents and consequences and writing about them. We're not doing that here, right? We're manipulating things. We're manipulating antecedents and consequences. And when you're actually manipulating antecedents and consequences to determine the function, that is a functional analysis. So what we need to determine is, what condition are we in? Are we in B, an alone condition? Well, no, obviously not, right? Because the technician is with the client. Are we in an attention condition? Well, no, because the consequence isn't to give attention. What are we doing? We're allowing escape. Therefore, what is likely occurring is we are in a functional analysis escape condition. So remember, for assessments where we are manipulating antecedents and consequences to try and determine functions, we are in a functional analysis in a certain type of condition. And then in each condition, we're going to take data on how the behavior, or the client, I should say, reacts to the consequence. So what is likely occurring is D, a functional analysis escape condition. A behavior analyst is in the process of shaping a client's ability to spoon feed themselves. The behavior analyst doesn't feel like the client has quite mastered the skill, but they believe the client is close. They then design and implement a changing criterion designed to increase spoon usage. Is this appropriate? Now, remember, how do we approach every question on the exam? We always do all our work up front before jumping to the answer choices. So we're not even looking at the answer choices before we really understand the question, because what you want to try to do is predict the answer. And when you can start predicting answers, that means you're really getting good at the exam. So is this appropriate? Well, what is what appropriate? The idea that the behavior analyst designed and implemented a changing criterion design to increase spoon usage. Well, on the surface, that seems okay, because changing criterion designs are used to increase or decrease behaviors. But what is one of the rules of a changing criterion design? One of the rules is that behavior needs to be in the person's repertoire, meaning they need to be able to reliably engage in the target behavior. What's the problem here? Well, the ability is spoon feed, and the behavior analyst doesn't feel it's mastered. So we can't reliably evoke spoon feeding. So how can we implement a whole changing criterion design? Our data are going to look very off on those times where the spoon feeding doesn't quite look like we want it to look. So one of the rules of changing criterion designs is we don't shape within designs in the changing criterion design. We need that behavior to already be there. So is this appropriate? No, a multi-element design should be used to increase behavior. Well, not necessarily. They have one intervention, so there's no need for a multi-element design. B, yes, a changing criterion design would be effective in this situation. If the skill was mastered, maybe, but in this case, it's not. C, no, the behavior is not yet in the client's repertoire. That is the issue. We don't have the behavior yet. We can't reliably evoke it, meaning that's an issue for our data and our behavior change. Our data is not going to reflect what is actually going on. So is it appropriate? No, the behavior is not yet in the client's repertoire. A behavior analyst learns that her supervisee, who is in the process of trying to earn her behavior analyst certification, is telling people that she is telling people that ABA is able to solve most problems in under a year and can often solve problems under 6 months. Knowing this is unrealistic, the analyst is concerned. Who is responsible for these statements? There's a piece in the ethical code about responsibility in public statements. And a public statement is any statement made outside of closed doors, closed meetings, or accessible to the general public. In this case, the supervisee is making plenty of public statements about ABA. That ABA can solve problems under a year and can solve problems in under 6 months sometimes. And that we know is just false, right? ABA is super effective, but one thing we never do is guarantee a time frame, because you can't guarantee a time frame. There's no way to do that. So we need to maintain truthfulness in public statements. So if the behavior analyst knows the supervisee is making these statements, who is responsible? Who is responsible for controlling the statement? A, the supervisee. Well, obviously the supervisee is responsible, right? They're certified by the board, or at least they're being supervised in an ABA capacity. They are responsible for what they're saying. Do we pick A and move on? No, we always read all of our answer choices. So B, the behavior analyst. You are responsible for what people say about ABA in public, especially trainees and supervisees and people who you are over. If you know this is going on, you are responsible to put a stop to it. You can't just bury your head in the sand because you're not the one making the statement. That doesn't fly. You are responsible. So both of them are responsible for these statements and need to correct it as soon as possible. The teacher of one of the classes in your course sequence often shows you videos of his clients engaging in different behaviors and treatments. You have an issue with this as you believe this violates their privacy. What should you do? All right, so you're in your course sequence and you're sitting in class and your teacher is always showing you videos of his clients. Now, what does your teacher need before he can show you videos of his clients? Well, he needs informed consent and assent from everybody. Training this way is positive. We using real life examples is a good way to demonstrate interventions and behaviors. However, before you can do that, you need permission. So if you have an issue with this because you believe it violates their privacy, well, it might. So there's something you need to do to see if your concerns are valid or if the professor/teacher has taken the necessary steps to show these videos. So what should you do? A, ask the teacher if they received informed consent to show the videos. Absolutely. Ethically, you need to just approach them and say, do you have permission? If you're concerned, you need to ask, do you have permission? And if he doesn't, they need to stop showing the videos. What about B, report the teacher to the BACB immediately? No, in ethical situations, we always try to resolve it first with the party involved. Always try to resolve it first. C, say nothing. This is not your responsibility as this is not your class. If you're concerned, you should say something. You've made it your responsibility, and that's all you can do to try to fix it. D, find out who the children are and contact their parents immediately. Again, we always try to address it with the party involved. Go straight to the teacher, ask, do you have consent? Likely they do, and then it's resolved. Go to them first. So what you want to do is ask the teacher if they received informed consent to show the videos. Excellent. Thank you for watching. Please like and subscribe if you haven't already. Brought to you by ABA Exam Review. As always, let us know when you pass so we can include you in the Sunday shout out. work hard, study hard. See you soon.